Have you ever thought about being a part of a clinical trial, but there's never really been one nearby? Well, if you have relapsing MS or active secondary progressive MS, this just might be the solution. Hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam. I've been living with MS for 40 years. I keep an eye on the clinical trials as well as the research that's coming out. And there is a brand new clinical trial that's recruiting all over the world. And I'm going to talk a little bit about that. I'll share an article with you, and then we'll look quickly at a couple parts of the clinical trial itself. And you might think about, is this one that maybe I want to get involved in? Let's take a look. I saw this article in Multiple Sclerosis News today. It was posted on February 7th, 2025. It's called Phase 2 Trial of obexelimab, Recruiting Adults with Relapsing MS. Trial to assess number of new actively inflamed lesions on MRI after treatment. That's their measure of success, is whether or not it can decrease the number of new lesions that are visible on MRI, which is the right measure for relapsing MS. If this were progressive, then looking at the number of lesions is probably not the best answer, because new lesions aren't really characteristic of progressive MS. But with relapsing MS, what you want to try and do is keep the disease from ever getting to progressive, and MRI lesions are a good metric for that. And they say that a phase 2 clinical trial is currently recruiting adults with relapsing types of multiple sclerosis to investigate Zenas Biopharma's experimental therapy, obexelimab, a weekly subcutaneous or under-the-skin injection, the company has announced in a press release. This study, called Moonstone, and there's the number, we'll look at that trial in a few minutes, is open to adults ages 18 to 60. Well, that leaves me out right away because I'm a little older than that. With relapsing remitting MS or active secondary progressive MS. So that would leave me out also because I'm not in active SPMS. Enrollment is ongoing at more than 40 sites across the US, Europe, and China, and results are expected in the third quarter of 2025. So it sounds like they're really moving quickly on this. They want to get as much data from all across the world as they possibly can, because that does make the data more reliable and trustworthy. So I appreciate that. And when we look at the clinical trial, we're going to look at the locations where these trials are being held. And they go on to say that in MS, inflammation in the brain and spinal cord causes damage to nerve cells, causing problems with normal nerve signaling that ultimately give rise to symptoms of MS. We know that only too well. One type of immune cell with a central role in MS inflammation are B cells. Several approved MS treatments, such as Ocrevus, Briumvi, and Kesimpta, work by depleting B cells by targeting a protein called CD20. And they say, though, obexelimab is designed to reduce activity of B cells without depleting them, so that's new. Obexelimab is designed to reduce the activity of B cells without depleting them. The therapy specifically targets two B cell proteins called CD19 and Fc gamma receptor 2b. And believe me, there's a number of different ways that can show up, so I had to look up how to say it, but once I saw the different ways that you can write it out, I think it was pretty obvious how to say it. But I don't think we really need to understand it beyond that. According to Zenas, the therapy is expected to reduce the activity of a broader range of B cells than available treatments that target CD20. This unique mechanism of action and self-administered subcutaneous once-weekly injection regimen may broadly and effectively address the disease-driving role of B-cell lineage in chronic autoimmune disease, the company stated. The trial is enrolling patients who experienced at least one disease relapse in the preceding year or two relapses in the past 2 years, or who had at least one actively inflamed lesion detected by an MRI scan done up to 6 months before entering the study. About 93 participants will be randomly assigned to receive 250 milligrams obexelimab or a placebo given by subcutaneous injections once weekly for 12 weeks or about 3 months. After completing the placebo-controlled part of the study, participants will have the option to enter an open-label period where all will receive obexelimab for at least 3 months. This will be followed by another open-label extension lasting 1 year. The trial's main goal is to test whether obexelimab is better than a placebo at reducing the number of new actively inflamed lesions visible on MRI scans. So you can see now why they would want someone with relapsing MS or active secondary progressive MS, because if they can't see any activity on the brain scan, new lesions or what have you, they don't know whether the medicine's working or not. The treatment's effects on other MRI outcomes and markers of nerve damage will also be assessed. Well, that's helpful. In addition to MS, Zenas is running other trials testing obexelimab as a potential treatment for various other conditions that are driven by abnormal B-cell activity, such as lupus. We enter 2025 with an opportunity to achieve major value-driving milestones with the anticipated results from our ongoing obexelimab Phase 2 and Phase 3 clinical trials, said Lonnie Mulder, founder and CEO of Zenas. We are extremely proud of the accomplishments of our dedicated team. Well, I am going to take a look out here at the website for Zenas Biopharma because they do have some information that you might find interesting. So I'll link this site below. Just looking quickly at this front page where they talk about our science. Here are the different tests that they have going on. And I'm not going to go through this. You can take a look at it. But the one that they're talking about in the article I just read is that second one, relapsing multiple sclerosis, Phase 2 Moonstone trial enrolling. And the primary endpoint after 12 weeks, the data is expected in the third quarter of 2025. So we are only about, 6 to 9 months out from seeing some kind of data on this, which is really fast, I have to say. And if we scroll down just a little further, they've got a paragraph about the multiple sclerosis work that they're doing. They say that we are enrolling the Moonstone trial, a Phase 2 multi-center randomized double-blind placebo-controlled trial to evaluate the efficacy and safety of obexelimab in patients with relapsing MS. The trial will utilize various MRI detection techniques and biomarkers to assess its impact in both the active and chronic aspects of the disease. The primary objective of this trial will be to compare the cumulative number of gadolinium-enhancing lesions identified on T1-weighted MRI after 12 weeks in patients receiving obexelimab versus placebo. Secondary objectives will utilize standardized assessments, imaging, and biomarkers to evaluate obexelimab's effect on disease progression, silent progression. Interesting. Okay, so they're going to be looking at disease progression even if it doesn't show up in your symptoms. That almost sounds like smoldering MS, but I don't think that's what they're getting at there. Upon completion of the 12-week period, patients initially on placebo will receive obexelimab treatment for at least 12 weeks, and patients initially randomized to obexelimab will continue on treatment. Learn more at the clinical trial. A lot of that information they already covered in the article, but I think it's probably just worth seeing it on their actual website. But at this point, why don't we go ahead and take a look at that clinical trial. And here we are on the clinicaltrials.gov website. Here is the clinical trial in question. It says it's recruiting right now a study of obexelimab in patients with relapsing multiple sclerosis, or the Moonstone trial. As you can see, it's sponsored by Zenas Biopharma. The last update was posted on February 4th of 2025. We aren't going to go through a lot of this because I'll just link this below and you can take a look at it. But what I thought would be helpful to see is this section, the contacts and locations for the study. And there is your contact number. The phone number is there. The email address is there. And they say that this study has 43 locations, and I will not go through these in great detail, but I wanted you just to see in the United States alone, there are places in Arizona, California, Florida, Massachusetts, Minnesota, Missouri, New Jersey, Ohio, Texas, Virginia, and Wisconsin. But if you are not in the US, take heart, because look at all these other countries where they are recruiting for this trial. Austria, so there's a place in Vienna, and in Belgium, and in China, in Croatia, in Czechia, in Denmark, in Greece, in Italy, in Poland, in Spain, a lot of places in Spain, and a couple places even in the United Kingdom. The other thing that you're going to want to look at are the participation criteria, because they go through first the eligibility criteria, which I believe the article already covered, but you can take a look at this. They do talk about needing to have an EDSS of less than or equal to 5.5 at the screening visit. And so you can look through some of this. And then also the exclusion criteria, I think, is highly important, because that keeps you from even bothering to go any further. Exclusion would include having primary progressive MS or secondary progressive MS without relapses, so that would include me. Meet criteria for neuromyelitis optica spectrum disorder, relapse in the 30 days prior to randomization, which is interesting, and then greater than or equal to 10 years disease duration from onset with patient's EDSS less than 2.0. So in other words, if you're too healthy, we don't want you. And then number 5, has more than 20 gadolinium lesions on the brain, MRI at screening. I couldn't really find good safety information about MS, particularly with obexelimab, but I did find this, so let's take a look at it. Visual abstract, efficacy and safety of obexelimab in SLE, results from a phase 2 study. And I'm just going to scroll down here, but I'll link it below in case you want to look at more. But they give you a lot of good detail, particularly at safety. So AE stands for adverse events, and the purple is on the left, the circle's on the left, and the placebo group was in black or in gray, I guess, with the darker color on the right. So infections and infestations were about the same, and treatment emergent significant adverse events looks like there were a little bit more of them with obexelimab rather than placebo, and then the treatment discontinuation due infusion-related adverse events. So who stopped the treatment because of adverse events? Well, 13.5 did, as opposed to no one on placebo. And these are the adverse events that were reported. Nausea, 38.5% on the medicine as opposed to 17.3 on placebo. Headache, 23.1 as opposed to 1.9 on placebo. Vomiting, 17.3 as opposed to 1.9 on placebo. Back pain, 15.4 as opposed to 3.8 on placebo. And dizziness, 15.4 on the medicine as opposed to 1.9 on placebo. Flushing, 13.5% as opposed to 0% on the placebo. And finally, pain in extremity, so arm or leg, 11.5% on the medicine as opposed to only 1.9 on placebo. I couldn't help but notice that the placebo side effects were all self-reported. I mean, even look at nausea. 17.3% of people on placebo reported nausea. So, you got to think there's something else going on there, because how can you become nauseated when you're not getting any medication? The only one that wasn't was flushing, because that's not something that you can imagine yourself having. That's actually something someone else has to see. So be aware that self-reporting isn't infallible. So you can see there are some adverse effects, and you need to look at those and decide if that's something that you would be willing to tolerate. And I don't know whether those are just in the beginning and they go away, or if that's something you would have to live with. Because I remember back in the Avonex days, every time you gave yourself a shot, you had flu-like symptoms. It didn't matter whether you were on the medicine for 3 months or 3 years. So that's just something that you need to decide for yourself. Okay, well, it's up to you at this point. I can't tell you for sure that I've uncovered all of the possible safety problems or side effects or any of that other stuff. That's something you really would want to look into a little bit more. Because, like I said, anything you put in your body, you want to be really careful about. This one does sound like it's got some promise, though, and might be really helpful if you fall into one of those categories. So if you have a clinical trial site nearby and you've been kind of thinking that, yeah, maybe being part of a clinical trial I would want to do that, because it might be of help. If not to me, it might help others. So if you do decide to do it, I wish you all the best. I've gone through several clinical trials now, but I have to say that this one that I'm about to do is the first actual pharmaceutical one that I've done. And I've always been a little reluctant to do them, honestly, because I try to preserve the quality of life and health that I have, such as it is, because you never know what side effects medicine's going to have on you. But I don't want to be overly wimpy either, because medicine has come a long way. It's done some fabulous things. But regardless, let me know in the comments what you think of this, and I'll see you again in my next video.